All right, folks, I have the gift of gab. I could talk till the yacht comes back. But I'm not going to do that. So how's everybody doing?
Very good.
It's after lunch. It's a little sleepy. You've heard enough of tech. So why is the doctor standing here? And why am I here talking about Slack and Salesforce? First question, who are patients? All of us. Anybody of you gave birth to yourself? You need prenatal care. That news for you, you will die one day, you can't bury yourself. We need postpartum care, postmortem care. So we are in the business of caring, and you can't care if you're not kind, and you don't know the person. So when's the last time you had a problem? Think about it for a second. Did you look for a building? Did you search on Google for somebody? You immediately went to another human being who could solve your problem. So what's the word disease mean? Anybody? Dis-ease. You seen a baby when they're born, they lay down there, they're happy, they are at ease. You're on ease with the universe. What is success? Fulfilling your God-given potential. Now I've been blessed. I've done this for a long time. I'm 17 and a half. I was in medical school. Now my career's been 40 years long. I've chaired large academic departments, hundreds of physicians, thousands of blah, blah, blah. But none of them were patient-centered. How many of you buy from Amazon? Just about everybody. How many of you buy from Costco? Just about everybody. If Costco or Amazon did what hospitals do to patients, for even $10, you'd be pissed. Right? If you order something on Amazon, shows up at the door, you can look at your order in a second. But imagine if Amazon said, hey, for you to order, check your order, you need to pay. What would you tell Amazon? But no, to check on a portal, my charge, you gotta pay some fees now. So what is the bottom line? Patient-centered, evidence-based, and you do it better, faster, cheaper. Now I'm a doc, I've done thousands of surgeries, I feel blessed. It's not about net worth, it's about self-worth. You know where the richest place in the world is? The cemetery. People make all these pieces of paper, they leave it somewhere in the bank, and at the deathbed, nobody says, I wish I'd worked more. Nobody says, I wish I'd made more money. They all say, I wish I'd loved more. Steve Jobs, anybody know Steve Jobs? No. You know his name, he left a legacy. He had billions of dollars, he could buy one more second and die in pancreatitis. Now one eternal fact, and we'll make a joke about this, but life is a sexually transmitted terminal condition. Think about it for a second. So you're born, you come into consciousness, and humans live at 3 levels. Physical, that's why you have the mind, body, and spirit. Same way of the Son, the Father, and the Holy Ghost. Catholicism, Christianity, other cultures have trinities. Why is that important in this discussion? Because we as humans feel before we think. Go to a blind guy and say, you're a blind guy. You're right, you'd be best. So humans want to be cared for, number one. They don't care what system you have. You walk in a room as a physician, I have 3 seconds to make an impression. Am I going to be trusted? Salesforce say our customers trust us to help them succeed. I say my mission on this earth is to be that human being who others will trust me to help them lead their best lives. So patients come to me not for any fancy treatment. If you have mice at home, you are not looking for the fanciest AI mousetrap. You want to get rid of mice. So coming back to taking care of patients. So I truly believe that no human being has ever healed anything ever. The body heals itself. Think about it. You have an infection, you come to me, I'm the doctor, I give you a piece of pill, you take it, your body has to heal. Now, we've talked a lot about AI. So everybody's afraid, oh, AI will replace humans' work. No. You know why? There's nothing called artificial wisdom. Artificial intelligence is going to do to the human mind that locomotion did to our legs. You can figuratively and realistically expand your horizons. We're using a lot of AI right now, generative AI, whether it's summaries of charts, etc. Excuse me. But all that is designed with one purpose, because I cannot process 47 pages of clinical records in a minute or two. The AI tool does it. But then I have to deal with the why. Why am I doing this? This human being is sitting in front of me. What do they feel? I have 3 seconds to connect with your feeling. As I am doing now, I got your attention, didn't I? Why? Because I made this personal to you. Andy talked about that digital front door. I hate that term. Which means that a back door, side door, there's no door. You can't come in. So healthcare has not been personal. So now where does all this come in with Slack? Everybody flew here on a flight? Mostly? Do you think the flight just took off on its own? No flight plan? The pilot flew the plane? The pilot didn't fix anything. So no plane anywhere on this earth takes off without a flight plan or a flight coordinator or a flight tower knowing. Patient care journeys are more complex than even flights. So why should a patient, you, me, everybody, be on this journey without care teams, coordination, having the information, all that stuff? I asked this question almost 23 years ago. I was the chair of radiology at Rush, large department, tenured associate professor, walk around in a white coat, made a lot of noise, thought what we could do. And then as soon as I realized this doesn't make sense, so I quit. And I remember saying, okay, there are all these people out there. Now you may be one person in the world, but you can be the world to somebody. That's what I want to be to every one of my patients, but I need the tools. How can I scale this? So that's where I started my journey with Salesforce. I started first by, I just needed to track a phone number, track a URL. EHR companies couldn't do it. If Amazon used the EHR company, what do you think would happen? If Amazon used Epic, Cerner, they're just holding the whole country hostage. It's okay, it is the truth. So what did I do? I quit all this stuff. Right now, I have every Salesforce SKU that is. I love Salesforce as a company. I'm not saying that because I'm here with them. I've had a decade-plus long journey with them. There's the only company that teaches you what to do. They truly believe in customer centricity. I believe in patient centricity. So our model is, if you're my patient, I'm centered on you. When you are in front of me, you are that person in the universe I want to mean everything to. Then I'm connected with you. Now I'm collaborating for your success. But I'm just one guy. I'm the pilot. There's so much other stuff to be done. I need to collaborate. Where do I do this? I'm going to show you all the slides, but I'm going to first tell you this. My team now, we're small compared to the bank health and everything, but that was by design. We're like we bake concierge care in what we do every day, every patient, just like Amazon. Amazon doesn't have a concierge care, it's Prime. So we have to build MIMIT Health Prime as well. Patients can text us, email us, call us anytime. We do omnichannel healthcare delivery. What does that mean? We see them in the clinic, we see them at home, we see them in nursing homes, we see them in digital health, we see them anywhere in the world. The father of the ex-prime minister said, "You've been my patient, you can go anywhere in the world." Billy Ness flies down to see us. California, I have several executives at Salesforce itself. And guess where we all connect? On Slack. Every patient has a Slack channel. Every patient is a personal account. Every patient has a care team, that's the account team. Every care episode is tracked. We do patient acquisition, so there's marketing. We track every reimbursement that comes in onto the object for tracking the journey, which is an opportunity. It links to the campaign. It tells me every ROI on every campaign. And we have a campaign for every minute. We track a campaign for every bit of that. How many of you could tell me the profit and loss of each care episode? Anybody? 0. We can. How? We took accounting seed, which is an accounting Salesforce accounting software. The check comes in, all that stuff goes in, it links to the care episode. They track inventory. I can tell you exactly the price of the device that was used in the surgery. I can tell you the average price, etc. And mind you, I don't code. I'm just a dangerous combo of this crazy physician who loves technology and has learned all this in Salesforce reaches. The first SI partner I had drove me insane. They'd say, "We'll get back to you." I'm like, "Where are they going and coming back found out they were reading trailheads. I can read trailheads. So guess what? I became an admin. I started figuring this out. Then I hired some more people, and then we found, they'll teach you everything you want to know. We took all of that, and we now throw it on Slack. So the first thing happens, every patient that comes in is a lead. So the lead qualification happens in Slack. If somebody had texted me and say, I want to be a patient, I immediately put it on a referral channel. Somebody picks it up, takes the info, connects to the person. If you choose Slack, we'll give you a private Slack channel. There's only one channel you can see. It's a it's a private, HIPAA compliant, single user channel. You can't see anything else. You have a family member, we'll put it on it. So we do that often. But then every care plan, every care episode, all of a sudden, you have a billing problem. And the billing problem is how many of you have gotten a medical bill? Nobody? How many of you threw it right away in the trash can? Nobody wants to pay the bill first. Nobody trusts them. Second is you say, God, I paid that already. I don't understand it first. Primary care, secondary care, just go back, this back, how much do I owe, deductible, all that stuff. I spoke to the head of United, one division, and he hates the plans. Right? It's all designed to make money, it's not patient care. So now, if you have a problem with billing, what would you do? Banner Health. You get a contact center call, right? What do? They text. They text us, somebody, and Nicole tried it. She texted me about a fake bill. My contact center texted me right away. This Nicole says she got a fake bill. She's not a patient. So I can see it too. So I responded right back saying, don't worry, Dr. Chopra meant you had a great time. All that happened on Slack, by the way. She could text us too. That is medicine at the speed of life. That is not front door, back door, top door, who cares? You as a human being say, I'm not feeling good. So here's a real story. Patient in Canada. The spouse is my patient, the husband is the chief executive, they trust me, they flew all the way down, I take care of them. Something happens, they need to go to another doc, and they need a report. How would any other health system provide that report? I was driving, I said, hold on buddy, 1 second. That was a Slack huddle, by the way. Pulled over, the PDF of the report, I could put it on the threw it on Slack. Within 30 seconds, he goes, got it. So you said approval. We do all the approvals too. Yes, we approve labs, test results, scheduling, coordination, all on Slack. So Slack, my team calls it Lucy. Anybody see the movie Lucy, the one where you don't use all your powers? They love it. Now I have one problem. They don't like to log into Salesforce anymore. But if it's not in Salesforce, it didn't happen. So we have Salesforce, CRM, so we have all the clouds. Every cloud we have, I got it. We got MuleSoft. Connected it to Data Cloud, EHR, Tableau, we have Snowflake, the EHR. All the data from my EHR goes into Snowflake. That includes patient engagement, clinical data, all the revenue cycle data. Patients don't get so pissed about anything else unless they get a bill that they feel they're not supposed to pay. They may have a bleed or complication, but still not as mad as the wrong bill. It's human nature. But all that stuff goes in. Goes into zero data cloud with the zero copy. Tableau analyzes it, and a dashboard shows up on my Slack channel. So we live in Slack. In fact, there's something called death by Slack, so now we've learned how to leave channels, etc. How many of you use Slack, by the way? Quite a few. So it's now my daughter, who's 32, works for me as well. And I did so much of this, and I got so much requests for this that I spun off a whole SI company. So we have an SI partner, we have Snowflake partner, it's called SIMS. We also partner with the EHR company, but it's all designed for small to medium business growth, physician practices. But we provide solutions. I'm not the engineer. We don't just go install software and run. It's like build you an F-35 F, and that's it. You need a hangar, you need to train pilots, you need to do all that. It's the same concept here. So coming back to Slack, we look at this. Here the example is one where a patient discharge, we do that. If you have, this I talked about claims billing. So that example, I was trying to tell you on my daughter, her young friend, she's 32, the young folks all live mobile, they want to move all the time. And they want care now. So, do you know why there's a $1 trillion beauty industry anyway? Because beauty implies underlying health and vitality. if you see something that's quote unquote not beautiful, you don't touch it. If something's decaying, you don't call it beautiful. Basically, everything goes down to human need. What is that? Live, love, learn, leave a legacy. Or live as long as you can, you want to feel loved, you want to be intellectual, learn, and then finally leave a legacy. Like Rockefeller, anybody remember Rockefeller? No. You know what I mean? Every human being wants that. So anyway, coming back, patient call. One of those young kids got a bill. She said, already paid. Oh my God, she's figured out. Guess what? I got a text. On her channel, I did add the RCM director, please check. This is 30 seconds later. He checks it, finds out that she had given the wrong insurance information. She's on her own Slack channel, very separate. Slacked her, she sent the picture. This was resolved in 30 minutes. Most of this would have been a call center conversation. This center pissed off, everybody's upset, she's mad, everything's going on. So that's the kind of speed of life. 10 minutes? Okay, thank you. So agents, so we've started already using agents. We're now deploying Agentforce today, but we've already been using it for transcription, summaries. We have live, we call them virtual assistant scribes. So I had shown somebody this morning. I'm having a conversation with the patient. I'm fully attentive to the patient. I'm not typing on anything, looking at. It's Zoom, got a HIPAA compliant, it's recording the whole thing, makes a transcript. I have a live scribe listening to the conversation as well. That scribe's given to an LLM, which is trusted, not used for training, PHIs. Safe, gives me a whole summary. That takes minutes. So we're using it for that. We've already started using it for claims. How many of you had to have any kind of treatment and needed pre-authorization? That's the new bad word. Insurance companies. You probably heard the bad news this morning. United CEO got hit. Now, that company is a $492 billion company, growing at 30% a year, never missed a quarter. So the joke is, the senior executive from one of these insurance companies' wife comes in and she's got good news and bad news. Just go to the hospital. So I have good news for you. Give me the good news first. She says, your insurance company stock paid you a huge dividend. She said, yeah. Bad news, they denied all your care. So the problem with pre-authorization is, they got the money, I got to do it. If I ask you, what's your insurance plan? Anybody? Give me one person, shout out what insurance you got. Blue Cross. He's like saying, what credit card do you have? It's a Visa. But you don't get paid just by Blue Cross. It's the plan. What credit card do you have? Which is the platinum card, gold card, silver card. And each plan has different details. And they are designed not to pay. How do I know this? I worked for one of them for a while, just to learn. They all use Salesforce too. They all use big data. When you go see a doctor, you got a injection in my knee. Medical record is done. That medical record, you send it to you. First they say you can't email it to them, you can't do this. You gotta mail it to them. Then so you can get it. The more expensive, the longer the delay. They take pride in saying we deny enough. All said and done, they have these guidelines. They hire a third party, to give these complex guidelines. I'm a professor, I've done this, I've written guidelines. Those are not designed for making another human being very well. It's designed for how can I minimize the payment. There's some need for it that you don't want unnecessary care. But you got a 47-page guideline. What the heck am I going to do with it? Throw it in Slack, do it to another LLM. That thing categorized everything for me. That's number one. Then we took the medical record, gave it to the LLM and said, does it meet criteria? Said, this is missing, this is missing. Anyone want to see it? I'll show it to you at the Yacht on my phone. Say it again. We did that, fixed the record, give it to them. My denial rate is close to 0. The A does. I'm having calls with the medical directors. Oh, you know, I still met all the criteria. And patients piss at me. I said, sweetheart, now my insurance company is yours. There's all the proof, call them. Next day, approved. So it's a game. But that's what we're using this for. Patient onboarding already told you. We asked them, he text us, WhatsApp. Now we're using agents on WhatsApp as well. We're setting that up. So we do omnichannel care. There's people talk about all this technology, but I've started from the patient up. So somebody, investor came to us. Well, this is fascinating. He says, how do I know it's real? I said, become a patient. We haven't been onboard on this patient, right? They use a Slack at this company. Onboard on the patient. I shook his hand. He goes out. He had hurt himself. The appointment he got was 6 months at Northwestern. I onboarded him in 10 minutes. 24 hours later, he had an appointment. 3 days later, he had his treatment. Now he loves us. Now he wants to make multiple clinics around the country on the platform. My point is, people want to feel well. That's what we do, onboarding, get it done. Scheduling appointments, the same thing. Now, we haven't gotten as sophisticated where the chatbots are reading all this soup set, but they're assisted. Patients will text us, we talk to them back, and we're still working on the omni-channel part. But our next step is with Data Cloud, with the Agentforce. We have an agent now before Agentforce came out, and you get a text, you say, hi, this is Mila, it's a startup. And so you got an appointment with Dr. Chopra, you have any questions, transfer to an agent. But you say, I want to make an appointment, you can see Dr. So-and-so, they click on a button, they can schedule it. We kept it this keep it simple, Sam, kind of method, just not get too, I can talk about all kinds of technology, patients don't care. So tell me, when's the last time one of you needed to talk to your doctor with a text? Anybody? You get an answer right back one, that means you know the doctor. You hang out and drink with him. That's the only way you can do this, otherwise it doesn't happen. Any questions? I could go on forever, folks. I wanted to give you a flavor of how Slack has become the center for us to collaborate. Every project, so I have a federation of companies, so we have 5, 6 different entities. Each has its own space. We use Slack Grid. Now it's all like Slack sales got their commission. So we have Slack Grid. So just so you know, two Dreamforces ago, I didn't know what Slack was. And I come to Salesforce, that's what it's called, I remember, because I had an incident the day before. I had a meeting with the Slack folks, did a POC for a month, and we installed it. We started. Holy smoke, did it take off. Now we've got Slack AI, so, I love work. In the sense I don't work because I love what I do, so it's on the fly. I take a mini vacation every day in my mind, life is good, but there's all these messages popping up. How do you keep up with it? Slack AI, unread, then go ahead and get your summary. Elevate, you can look at all our care episodes and we track what's the status on this. Patient called and said, or patient discharged from a hospital. Let me ask anybody here, you all work at hospitals and systems, if a patient was in another hospital and discharged, how would you find out? So anyhow, somebody reaches out to a patient and they say patient discharged, not available at team or at the person, patient discharge channels closed, everything's done. All that is updating the cases, everything opens a case. We've got workflow automation out the wazoo in Slack. I can't say enough good things about Slack. And it wasn't a problem installing it for us. And we run 7 different workspaces on it. And HIPAA compliance from the people who have medical records are just in that record, nobody else in that workspace. And we're collaborating up the wazoo from analytics, so patient acquisition, analytics, and everything else in between, all in Slack. I'll give you one example. I have 3 more minutes, so I'm going to take up the time. Why not, right? There's a gentleman who worked for Salesforce. He met me at Dreamforce, good Dreamforce. Same thing. He wants to keep me happy. Had a big profile with them, crazy enough to do all this fun stuff. So he comes to visit me in my clinic because he moved to Chicago. He leaves the clinic, being my patient. So 3 months later, now he's working for me as my lead tech architect. All good, he's a great guy, a lot of fun, but he's my patient too. He's got his own personal channel. He's coming to this current Dreamforce, and he had gone to visit his family in Toronto. On the plane, he realizes, oh shoot, I don't have my meds. It's insulin, which means he's going to go to the ER. He's going to be unhappy. Emergency room's unhappy. The insurance company's unhappy. What does he do? On the plane, slacks on this channel. Contact center gets it, and the second provider is getting from him gets a message. They ask him where he uses San Francisco, where. They geolocated his place. And all our patients are located, by the way. We do use territories for that. And I was trying to do a field service lightning to help providers go for home visits. his prescription was called in by me on the other flight that I was on from my handheld to their pharmacy. He went, he picked it up, got his meds, life is good. That's called medicine at the speed of life. And nobody has to pay anything extra. Now what do you think happens? He's referring patients, everybody's referring patients. Now what challenges do I have? How do I scale this? I have folks who come in, and that's kind of where we are right now. Thank you for your attention. Really enjoyed this. Bless you.
Anyone have a question? We go to number 182. Any takers?
You know, it's really good or really bad?
Really good.
So, I'm curious, how do you get your patients on board with Slack in the beginning? Like at first, were they like, what is Slack? How do I use this? How does that work?
So you see, we have patients who are in their, well, really young 20s, to patients in their 90s. So the 90-year-old comes, they all have caregivers. So we track the household. So we have so there's a simple rule in our organization. If a human being shows up, you have to know their name, you have to know the mobile number, and their email. The next thing is 4 questions you gotta ask. Who's the patient? Who sent him? Who is involved in his care? And who's the payer? Those 4 minimum required. We track all of that. I call it P3R. Patient 360, provider 360, and payer 360. It means we know every aspect about it. So the young patients we ask them, you have a choice. We don't like text, it's just hide this, but it's not secure. WhatsApp is secure, especially overseas, a lot of them like WhatsApp. Even businesses now use WhatsApp. But the young ones, do you use Slack? Oh yeah. Would you like, really? They love it. Even their family members will love it if we can take care of their loved ones with Slack. So they love that because you can do video, audio, huddle, this, that, everything else. If they don't use Slack, then we use something like WhatsApp if they can. If not, there's some patients, I had a gentleman who's 78 years old. He's like, I'll drive. He doesn't want to fill out any forms. He got the text message. He drove in just to show the car, take the pictures. He said, I have nothing else to do, don't worry. so we go by, we track patient communication preference, and we start doing what do you prefer? One of them is Slack, one of them is WhatsApp, text message, and it's a multi-select list. I hope that answered that question.
Thank you, folks.